Hi, Tonia. My name is Laura. I'm a student nurse, and I was wondering if you could give me an S-bar on your patient Marta.
Sure, I sure can. Miss Marta is in room 529. She's an 80-year-old female. She's alert-oriented times 3. She has no known allergies. She's a full code, and however, she is a little bit hard of hearing in her left ear. She lives alone, and she has no family in the area. She arrived here Tuesday with a stage 3 ulcer, sacral ulcer, and has been treated in the outpatient center. Dr. Jolly has seen her and is scheduled for a debriefment tomorrow.
But really, I was just
her reflexes are +1. She has lower back pain.
Now what I'm going to do
that
is
right now on the scale, she's a 0.
We're going to hang this lower than
and Tylenol
we're going to make gravity our
helps her
friend
with that. She's a walker. She's up with assist. She has some generalized weakness. Lower extremity is where her weakness is, and she has limited vision. She is a fall risk. Her lungs are clear with diminished sounds in her lower lobes. She has a normal sinus rhythm with premature beats. She's on a regular diet, but however, she had loss of appetite. And
so
her bowels are all present in the
to make sure that she's running
four
correctly. We want
quads.
to
She
make sure we
has
have
stress,
5 drops
incontinence,
before we walk away.
and nocturia. She has frail, poor skin turn, and she has serious exudate on the wound. Her wound is 4 by 4 by 1 with no undermining or tunneling. Her labs are back. The INR is 1.0, and her PT is 11.8, so she's ready for surgery for tomorrow. Her albumin is low at 3.2, and her blood nitrogen is 22. Her current vital signs are 144/90, pulse 88, respirations 24. Her O2 stat is 92, and her temp is 99.1. She'll be NPO after midnight tonight. Right now, she needs glaramycin, which is an antibiotic, and sodium chloride with potassium. We have 2 labs pending, and we're waiting on the nutritional consult to increase protein in her dietary needs. We have also electrocardiogram and a chest rate outstanding that will need to be completed today.
Does the
And any
go on the one with the antibiotic?
No, you had it right. You have everything set up correctly. It's just when you go back and hook up the antibiotics, you have to.
I forgot. Sorry. That's it.
Okay. Why specifically is the client receiving this medication?
She tested positive for E. coli and gentamicin sensitivity.
Okay. And what action does this medication have on the body?
It stops the growth of interrupting protein synthesis.
I don't care.
When should you question administering this medication?
I would question when administering this if she's allergic to sulfites or aminoglycis, like glycogenesins.
Okay. Does the medication have a therapeutic serum level?
Yes, it does. It is. They'll monitor the peak of 5 to 10 mgs over liters, and the trough is 0.5 to 2 milligrams per milliliter.
Because you have to try it without it.
And what vital signs must you monitor?
What vital signs? Your normal, your blood pressure, your heart rate, your respirations, the trough levels, as well as some blood tests and possibly urine if she has it with Yeah, in future, if she ever has any problems with her urine tests would be also included.
Which physiological parameters should be monitored when the medication is being administered?
You would monitor this particular antibiotic has contraindications of tinnitus or in hearing loss.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
That basically with this particular drug, there are a lot of side effects to this particular drug. So anything over the counter or herbal or any other drugs, she should notify her doctor.
What interventions must be taught for taking the medication safely at home?
Oh, your secondary is in the back bucket over there. Oh, okay.
I think it's ataxia for the mobility to move.
Okay. What are the side effects and potential adverse reactions?
Allergic reaction.
How will you know the medication is effective?
Because there would be no E. coli in the blood through a blood test.
Okay. Thank you.
Well, I think when she asked that, I was just like, me too.
Do you want to go in with me?
Sure.
I'm pretty sure that you can't have more than 12.
Hi. Hi, Marta. This is my name is Tonia. I'm your student nurse today, and this is Laura.
Hi.
She's a Oh, she's the student nurse. I'm the nurse. Pardon me. I really do know what I'm doing. So, do you mind if she comes with us today?
Of course. That's
okay. Perfect. I'm gonna wash my hands. Are you having any pain?
No pain.
No pain.
Feeling good.
You're feeling good. Okay.
We're gonna, should I use my phone? I was gonna use my computer, but I don't want to use my computer. Put mine here.
Have you ate dinner?
I did.
Okay. Can I get your name, date of birth?
Martha Yam. And I'm 80 years old.
And you're 80. Okay, great. All right. So Marta, today we have I have to hang some IV fluids for you to keep your veins flowing. You're going to have surgery tomorrow. Were you aware of that?
Yes.
Okay. And so they're going to do a debridement of your sacral ulcer that you have.
Okay.
Okay. And then I also do have gentamicin, which is an antibiotic. It actually stops the bacteria from growing. Okay, so we're going to do that all IV. Okay?
Sounds good.
Do you have any questions?
Nope.
Okay, perfect. Let me take a look at your IV. It looks very good. Right, but we're going to flush it. Do you have any pain?
Nope.
No pain. Okay, perfect. So I washed the up here just to keep from bacteria entering.
Okay.
And we're going to go ahead and. Oops, sorry. Let me actually open this and do it the real way. I forgot we were attending. That's good. Do you have any pain?
Nope.
Okay, I'm going to leave that there. Since we clean that. Let's go ahead and prime the line. We're going to hang your IV fluids, which is 9% normal saline with some potassium.
Okay.
Actually, first I'm going
It's not bad, Nate. It's real cheese.
to check. Okay. So let's see. Normal saline, it's 125 per hour. And that is correct. And then I also have your antibiotic, vancomycin. It's at 80 per ml. Correct. And then also, and then I also need to, can you give me your name, date of birth again?
Martin Yam, and I'm 80 years old.
Okay, so that matches. That matches. We're hanging it, and the glenamycin, I'll be back in about an hour, and I'll remind at the end again, so we make sure that you get all of the antibiotic.
Okay.
Okay.
We're really
So,
for it. You would say it's dependent on
go ahead and do chart everything real quick.
No, it's done. Is there what's the therapeutic range it should be in? Say that it's dependent on the program. That's all I'm saying. Yeah. Where is it? I know. Some of them is like how much are you supposed to give depending on whatever's going on. So you get how much depending on programs.
Yeah, it's like I'm gonna be like, yeah, it's like
I don't give a shit for that. I still use the research it. What over cheese? Rock on.
Okay, so I got that verified, and
Cheese,
put the amount in here,
liquid correct.
and the time, 1600. Okay. And then your IV is in your right arm. Perfect. So I'm going to go ahead and Pharm the line. Sorry, I'm going to change my gloves. Get some new gloves.
Where am I filming it?
So I'm going to look at the expiration date. Now you don't have any allergies, do you? No, perfect. And I'm going to make sure the expiration date is good, that it's clear, that doesn't seem no abnormalities of it. And I'm going to be careful from touching the spike so I don't contaminate it. I'm going to prime my line. Make sure there's no air bubbles.
cheating. I'm like, I don't know, it just talks to people. I just have to open the.
What is this from?
No, I had an iPhone last semester. It just
Okay, wait.
I usually don't use it.
No, I mean, I can do that.
I'm not gonna do all of it. So, yeah, like, you know, let's use it.
Oh, you set one up for her?
She went to the ICU at St. General and had to go in, and she came home with like 4 IV bags. So I'm like, guess what? My test is tomorrow. Let me try this in this way.
What? But she got the discharge without the use.
They wrapped it up so they can see when she left.
They left it.
She works there. She didn't go to the patient.
Oh, I was so confused.
She just went and like found one of her nurse friends.
So
Like,
funny.
"Put this in my-"
Hey, that's open.
And stole bags. That's funny.
That's open.
Okay, we're doing
So
it.
now we're starting to prime.
I would have been in the back though.
We want to make sure all the air bubbles are out.
Yeah, I'll still put it on.
So I'll slow down that for some reason. Alright. And then I'm going to get the flow meter out. And this has been sterile because it's been sitting inside the package.
So my patient is Marcia Yarn. She's an 80-year-old female Hispanic. She's a full coat.
I'm going to have it on prime. So I'm going to prime it through the flow meter.
She came in for a non-skin ulcer. She's had it for 3 months, and she is treated as an outpatient. She has a history of dehydration and pneumonia. She doesn't smoke, and she has no
Okay, perfect.
we're keeping her in, but we're also going to come out.
So then I'll remove this since it stayed sterile.
Her cranial nerves are intact, and that's important for the.
Go ahead and connect it.
She has symmetric
Okay. And it says here 125 per hour. So I'm going to go ahead. So, and then, let's see, 125. So that's actually fusing there. So since we have to hang the second piggyback, I'm going to actually take this off. Wash my hands again. Another pair.
She says she has occasional stress involvement with bacteria, and she doesn't tell me about it or anything like that. She's been I would recommend putting in a nutritional
First close. Don't quite fit my hands. Okay, so then I'm actually going to turn it off because we're going to hang your gentamicin.
Yes, I'm going to give her gentamicin, and we're going to give her a sodium chloride potassium.
Okay, and the gentamicin.
And then she's urine meds.
Why is she getting the antibiotic?
She's having gentamicin because of her sacral wound, and so it's a bacterial cycle that'll help inhibit bacterial
Okay,
growth.
so I'm going to type in the number.
What would you question if you're going to medication? Well, gentamicin, biggest thing is the nephrotoxicity, so you want to look at her fear.
594 0905 652.
Also, you want to check her
Okay, and then I'm going to put this in. 9 D9 CCB C5 79B0B. Okay, I got the green light. I'm checking no expiration date, or the expiration date is good, looks good, and so I will continue with the piggyback.
You want to monitor.
So the first thing I have to do is prime the secondary.
Just to make sure everything's stable, but you also want to check for
says,
Autotoxicity, that's the problem target with prolonged gentamicin use. So you want to check for
okay, this is off. So the first thing I have to do is scrub the hub. Then I'm going to have to prime.
What interventions must be taught to the client to ensure that medication
This lower to secondary prime.
Well, since it has hearing loss, you want to tell her it's important to report the hearing loss. You don't want her to just not report it and flip that because she thinks she's going to bother someone. You also want to tell her to get out slowly and carefully and change positions carefully, especially for the hearing loss because she is fullness. You also want to make sure that she drinks enough fluids and stays hydrated. Again, because dehydration can cause toxicity.
So then the side effects and the adverse reactions. How will we know that the medication is effective?
Fluid levels, effective, flavor for stage 3 when you start feeling. And if it's not, then there's no risk because like I said, too much gentamicin.
And set the new dial at 80 or at 100 minutes.
Hi Martha, my name is Keegan. I'll be your nurse today, and this is Kayla. She's going to be with us. How are you feeling today? Can I have your name and date of birth? Martin Yarn.
Now that we have you all hooked up, put the same thing in the left hand. Everything is right hand, sorry. Everything is one. Diaphragm, everything is fine. Okay.
Well, we're going to give you your gentamicin, which is going to help with X-ray and your emissions care.
Now that we have that started, I'm going to be back in about an hour. Actually, probably about 45 minutes to check on you, and then we'll go from there. And did you have any questions? No. Do you know much about the gentamicin? Like some of the things to look for? If you have any problems with your hearing, please notify us. You can just push the button, anything like that. Or if you have some nausea, vomiting, please let me know right away. Do you feel fine right now?
I feel good.
Okay, perfect. Okay, so I'm just going to go do some more documentation. Okay. And I'll wash my hands and go do some more documentation. And I'll see you in about 45 minutes.
Sounds good.
Was there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, we did look at her creatinine level, so looking at her kidneys, also the trough, making sure she's within the limits to give the medication.
Did this information affect your decision to administer the medication?
Yeah, because her creatinine level was 1.1, and that's pretty much what would make the decision.
Did this information affect how you administered the medication?
No.
Okay. I don't have any more questions.
Okay, thank you. Would you like to watch us document? Sure. Okay.